You can easily find it by moving the leg. This is the patella. You feel it? This is, and you can see moving here underneath. This is patella, and then you do an incision from like just finger under the trochanter. I like to angle it a little bit more caudal to have a little bit more retraction of the gluteus. So you can also do straight ones. So you just go ahead and do a straight incision. Also, this is fine. Sorry, guys. Like this. And you take your scissors, and then remember in the cat you say?
Which one we are doing now?
Hip replacement. The hip toggle. Hip toggle. It's very blue.
You need a light? You need light?
Yeah, if we have, it would be great.
We have, yeah.
Oh,
Wow.
for the endoscopy. So if you start doing it, you can also go a little bit larger, like increase your approach. There's a little bit of fat going on here. So now in the cat, remember that you have the femoral, the biceps femoral muscle. You also have the caudofemoral here, and then you have the superficial gluteal here on the top. And then you already now feel the third trochanter where the superficial gluteal is going to. So. And sharp scissors help, for sure, like this. And so now you can see that you can approach, there is some fat here, which you can remove to make your life easier. And then you can
send the video to me as well. Thank you.
go in here, then you cut the superficial leaf of the fascia lata, and then you have here also the tensor fascia lata, and then you go in between up here and elevate it, and then you can see here the gluteal muscle coming down, you see? And then if you have this triangle, this is where you enter your joint, no? Like this there, and you can easily feel it by put your finger in here and then just do this twisting motion, then you will feel the femoral head in the depth.
Can I see it?
So I usually do not more than this approach, like the size of the approach. I usually do it to this approach, but we will now open up so everybody can see. Can you feel it and down? Just go rotate, because then the femoral head will come towards you.
Yeah.
Yeah?
And how are you able to see the acetabulum with this approach?
Say again?
How can you see well the acetabulum with this approach?
I will show you.
Thank you.
So now, as I said, I use usually a small approach. I will now extend that everybody is able to see. So let's cut it a little bit more. The poor cat. Let's do a gigantic approach. So now usually you don't need a tenotomy of the gluteals, which are here. So you can see here the gluteal muscles. So usually it's enough if somebody is retracting for you. So I would ask you to retract here in this direction. And then I will add a Gelpi retractor, and usually I use the small Gelpi retractors for cats. And now if you rotate outward, you will feel here the femoral head there. There's the coxofemoral muscle in the depth.
Correct.
Can you just rotate it a little bit? Can you feel it? And then I usually use a number 15 blade and see if we have one.
Sorry?
Number 15 blade. I think there is a package of number 15 blades.
This side, no?
You felt it?
Yeah.
So take that one. Now you take outward rotation. Find your head position here. You see it? So I now go in to destroy all this tissue around here to make the head come out, and now you can see already here the capsule under the coxofemoral muscle, and you can see the head coming here. Can you see it?
Yep.
Yes. There it is. So we will cut this here. We will cut the capsule, and we'll help the head to come out. So
Yeah, perfect.
So everybody has a look inside. You see here is the head
Yes,
Head of
yes,
the
yes,
camera.
yes.
moving, you know. Let's cut all this tissue here that we can get it out. Now two ways if it's still in to luxate it. Either we go like this. This is now
To go
this
to
is,
cut the internal ligament.
yeah. So this is ugly. So please close your ears. So let's just go like this.
This is
Oh,
a
okay,
great
you want to
movement,
luxate it.
I want to luxate it, but it's a
But I usually have I don't know the name of the tool to go inside that
hot spoon. It's
that
a hot.
one.
It's a hot spoon, but we
with
don't.
the blade as a
Yeah.
V. I go inside and I cut the ligament with
okay.
that.
No, I don't use. I use a hot spoon usually, or you just do. I mean, this is a very like.
Hot spoon to break it.
Hot-
Really,
No,
to
to-
luxate
No,
it.
it's not
Yeah.
sexy, but this is ugly because it's like some people get. Okay, now
Consider this
Yeah, you
as
can
a
see the
luxated.
contour.
now this is a luxated hip.
Yes.
We can see nicely here the fovea of the head where the ligament went into here.
Yes.
Okay.
We can nicely see our neck here. So
Yes.
this is the neck.
Yes.
You see, from here all the way to here, and if we go back here, we can nicely feel our
trochanter.
third trochanter. So I want you to recognize that it's a large distance. So this is the greater trochanter up here, and it's all the way down here till the third trochanter comes. So I usually do a tiny little opening here to better position my drill guide, and then now you can really feel it here, the third trochanter. So if you just free it a little bit, I usually do it with a periostal elevator. So just go in here and get this free a little bit, and now you can nicely
Can
feel
I?
it here.
Ah, yeah.
Can you feel it?
Yeah. Yeah, I need to see it.
Feel it? Be aware that it's quite a distance.
Yes.
And you can also feel this, or you can also experience this if you take a close look to the neck. So if you look at the neck, it's going down
You see,
here.
it's the
You see?
direction it
So
goes.
we need to be here. If
Okay,
we
so you
are
can-
up here, we will exit the
enter.
neck up here.
Yeah.
You know. So the neck angle is really steep. So we need to be aware of that. Okay. So now acetabulum, hard to see. Some of us are not trying to like this, pulling down, going crazy because we don't see. So what I usually do is that I slide my curved forceps or baby Homan or whatever you have. I think the curved forceps goes best. I slide over the greater trochanter, over the neck, just down here, then turn it around and angle it under the hip and then pull it down, and now you can see. Okay? So you just go over it and you gently find your way. Be aware that there is also nerves down there and vessels, and then you try to anchor it there, down there, and then you just turn it around so that the curved part is going under the bone, and now you can really pull it down. You see, you can really look in.
And to just take out the head of the femur, luxate it out and extra rotate, you
See?
can
You
can Okay.
mix them.
And now you can really see here the
I have to
acetabulum.
catch first
Can you
before
see
I
it?
mix them.
There's the acetabulum now.
No, no, it's okay. You
So
can see it.
give me this.
Where's that?
Give me the retractor, please. So I will reposition you. So now if you go like this and pull, you can really nicely see the acetabulum down there. Can you see it?
Yeah. It's there.
Come on this side, everyone. If you want, you can come on this side, on my side, so I can show you. So this is a nice way of showing the acetabulum. Be aware of the structures down there. Now I usually clear with a sharp spoon the fovea. Yeah, with a curette. We can also use it. Can you hold on this, please, for a second? Then I take the arthroscopic curette.
Why we
Make
don't
it
use the camera? There should be a camera and show here.
Yeah, exactly.
By the way.
Yeah, actually, you could have put the camera and record everything
And we see.
through. Would have been clever.
He's doing it now, I think.
So now you can see I get the remnants of the ligament out. You see, now we can look at the base of the fovea here. So there is the base.
No, no, I mean, yeah, of course. I
See?
So when you find a section of the ligament is where you make the hole.
Yes. The fovea here, you can see the articular surface.
Yeah,
I can
okay.
show you. So
Just remove that one.
this is the articular surface here, all the way around, and then you really drop into the fovea. Did you see?
Over
Up.
the rest of the ligament.
Well, yeah, here, there is the fovea. Here, this one.
Now we
This
have
one is the
better vision.
fovea. Do we have a swap, or and I can show you better?
There you go, I can see it.
Paper. Also, this one is fine.
I cannot see if it's now.
It's not clear. Let me just see one. Okay.
So let's go ahead and do this.
Just want to
That was
make
a nice one.
It's very clear. You just have to.
You need like something to fit it, and that's it.
It's okay.
Very cool. Thank you very much. That's nice. So now, if you see in
Yeah,
here,
this
now
is
you
cool.
see the base of the fovea. See?
Yeah.
See? There.
Yeah.
This is the base of the fovea. Here.
Yep.
You see it?
Yeah, yes.
So now you just need to hold still.
Because I cannot see here, so I can.
Come here.
So there is the fovea here inside there in the depth. Articular surface, fovea inside here. Okay. So now what we do is that I go in with my drill, and usually you have the drill guide for it. So where's this blue drill guide?
Guys, not even move out from
The drill guide, the drill guide.
Find the drill.
I think it's there.
No, you're
So
you're-
you would use a drill guide to protect everything that is there. You can
Okay.
push down a little bit more.
Yeah.
So now I go to the center of the fovea where
So
the
you are
ligament starts.
underneath the ligament, okay. Not
So
exactly over it.
well, what is, I'm exactly where the ligament usually starts. You know,
The point is the ligament, right?
the point is the
same
ligament.
place
Yeah,
for the
because you can really see here this half moon that I was trying to draw, and in the middle this little slit where the ligament originates. Correct? Everybody's able to see. That's where I start,
The whole that
right
you
there.
showed.
See?
The whole like thing
Yeah.
that you showed.
And
So
then
it's a
you
little bit dorsal,
angle a little bit
okay.
like this, and you start. Bam, you're through. It's a dead cat. I mean, you just.
Yeah, but it would be nice.
Easy in a live
So now you see the hole inside.
Yeah. Yes, we can see from here.
You can see from.
Yeah. You can see
So
it.
there, I take the curette now to show you. There is now the hole.
Yep.
No major nerves right behind
Okay.
that can
Yeah,
touch right
exactly.
away.
The rectum right behind.
So
So don't go. I mean, I
Oh yeah,
wouldn't.
there you go. Guys, that's the
You
hole.
go through, you're done. You go out. Yeah, there is the hole.
Then a question, in like a normally it's very easy to do the hole, like in one
it's,
set.
the medial wall is very thin. Don't go crazy. Just go zip, and you go
Okay.
out. When I started doing it, I went in oscillating mode because I was afraid of getting the rectum. But when you do a pelvic split and you look inside, like for this spike is much smaller than in the other one.
So can slide from the
It slides
ligament.
easier. We are now discussing with the authorities to get a bigger spike here in order to have better
hold
hold.
it, right?
Because you will see now when we do this, so you can move out.
Question, you put first the implant inside
Nope.
the setup? No.
We do all the preparation,
Okay.
all the drilling, everything,
So
and
I
then
can-
we get. Yeah, you can move out. Yeah, correct, perfect. Yeah, just turn it. Yeah, perfect. So now you see, I want to have this seated here, and I usually pull out then a little bit, and then I want this to be seated here on the third trochanter. So in this specific drill guide, I will need to always pull really hard that it's not slipping, you know. And then we're gonna prepare our machine.
If I'm not there, you guys cannot.
Hey, but can I have this one or the two hands?
It's actually very helpful.
Oh, right.
I can help you.
It's okay, put your and don't be shy.
And always be aware, here is the, when you now retract like this, look what you got. This one. So the cat will be,
Sciatic.
This is the
Yeah.
sciatic what I just grabbed.
yeah, that's what the sciatic what you grab. So we don't want to grab it.
No, huh?
No, we
Not
don't
even to
wanna
keep
grab
it away from
No,
what you're
Nobody's
doing.
grabbing.
I just don't want to have it, leave it, I just want to.
Live surgery.
Yeah, he's there, he's fine, I know he's there. It's like if you're 100 meters away from a crocodile, you're just, okay.
Keep away.
Just stay, don't try to fix it or whatever, just leave it. Because this guy, if you damage it,
You're done.
But can I just damage pulling with the...
yeah, you at least will get neuropraxia.
Okay,
So the cat will be the next day.
but not something permanent, just temporary.
Depending, we are, here is the third trochanter there. So we want to hang this in. And now we need to see that we get this
It's
nicely.
really nice.
But it slides easily. Yeah.
Yeah, so it slides easily, so this is the problem. So let me,
Somebody hold
Should
it.
we will
On this
get,
side.
no, we just can remove it. So now we just get this in, and then I will get this down and check the position, so it's there. So I can remove it a little bit, and then now really get it down here. You see? So now it's in position. And now we take this one. So it's now the third trochanter, and you see that I double checked always my position. And now you go in, and as I said, take it easy. Don't pull too much, push too much. Just let it roll on its own. You see, now it's moving. And then as soon as you feel it on the tip, as you feel it like wiggling around on the tip, now I can feel it, I stop, and then I remove everything. So in this one you have to press this.
And then start.
So you press, you slide it out, get it out. Let's see if we already penetrated
not
somewhere
yet.
here. No, we didn't. That's good, because I want to feel it at the metal and then remove that it's not redirecting when it hits the metal. Make sense?
But
I
if
just
you do
want
not
to-
go out, how can you know that you are getting out in the right place?
Because now I'm in bone at this length, so there's
So you
no
are in
way
the
around it.
in-
I'm the
okay.
correct angle, so there's no way around it that I will exit. The only way around it is that it hits this metal.
Take it 3 minutes, that you can.
And
Okay.
this would be acceptable for me, yes. So now we get our drill set, which will be that one. It's a 2-0 cannulated drill bit.
That goes around.
Yeah, so as you can see, this will slide nicely alongside.
Yes.
So now we need this.
I think this is the best. It's much better.
See if this grabs it. Because this is a special drill. It should be. Yeah.
On my stand.
So now we do the over drilling. Ah, now we need also the cutting bits because it's a small one.
But I don't know if this is big enough.
No, we need
There was
so you need the side part. In the big machine, you have the cannulation.
So the whole pin goes
Yeah,
inside them.
yeah. So now what you can do, I'm sorry I didn't tell you. What you can do now is now you have your pin angle, correct? Okay. Now we want to check if we're happy with our angulation in the neck. So what I do now is that I recheck my neck. I can see now that my pin is running here.
Perfect.
So
So
it's
it's inside
perfectly
the
in the
neck.
center of the neck. So this is good. Otherwise, if I would see now I'm too dorsal, I could still redirect. Make sense?
So you have to-
You could
Do you
go
see
back
the
out.
pin over here?
No, but you see the axis of the
Ah,
pin
axis, okay,
by
triangle, okay.
by just
Estimating.
thinking the line from here to here, and I see now I'm perfectly centered
We are-
in the neck. So
And
that's
we don't see it on fossa, so
so if you see it, if I would now see it would, for example, let me grab another pin. If I put my pin now in the line that we are having, we are perfectly in the center, so it's nice. So I'm happy with that. And we also didn't feel, which is also a good sign, not 4 cortices, because otherwise you would have, but only
evenly it's going.
zip and out. This is also a good sign. So now we just over drill it. The pin, if you don't hold it here, will come out with the drill, which is not a problem in this procedure, but if you do other procedures with cannulated drill bits where you want to keep the pin, it might be nice to have it inside. So now we just go ahead.
Makes sense that the
We did this one. This is now not good, yeah. Just press it down maybe.
wait, I can grab it
We do
better.
retraction here.
Yeah.
Now we will over drill it.
Going in, goes the other way.
And usually you will have your retractors there, so you're through and you will flush.
Why we were over drilling? I forgot.
To have with the pin,
Yeah.
the pin is the initial seating that you can check your position if you're good, if you're nice, if you're, and you can use it through the C guide. But now we need a bigger hole, and that's why we over drill.
That's
For
why
the
for the
material.
Yeah, to get the suture material. And of course, we flush with suction because we don't want to happen the smoking that we just saw,
Yeah, of
because
course.
this will lead to osteonecrosis. Always flush, take it easy. You all know. Okay, so now done with the preparation.
Okay.
Now the next step will be, as we do a mini tightrope, we need to disassemble. Remember when I told you? We cannot normally, in a dog now, with the standard preparation, and now I'm taking this out. As I said, I would leave it in. I would
Changing
get
the gloves.
double gloves. I would get another drape just to make sure that it's not touching the skin. Raw egg. Don't let it touch the skin. You will be in trouble if this gets infected. It's a pain to just don't do it. Just be aware that you really need to. Yeah. So, and now you see, in this case now, if this would be a dog, and we would have drilled 2.4 here in the neck, for example, bigger dog, 2.4 drill. You just take the needle, put everything through,
But we cut for
put
the
this inside, done. Now, as we cannot pass the needle through because we drilled 2.0, and also this button will not pass through because it's 2.0, we need to disassemble.
So the button in the acetabulum, and then you.
And
pull
then the other
rest
way
to
around,
the-
yes, correct, the other way around. So what you do is that you just get rid of this guide needle that you have, just cut it, keep this one here. Then usually you can easily untighten this knot because it's very rigid. Not in this one, which is good.
That's why.
So this part will be removed and applied again after.
No,
Yes.
it's on the
In
other
here.
side.
This one will be removed.
Head of the femur, acetabulum.
Yeah, but this will be removed from
No,
the
no,
wire.
no.
The button will be
That
removed.
will be
The
the
button will
button.
be removed.
But the
No,
wire-
no, we will
No.
tighten it.
Yeah, but it will be removed
this has
first.
To be, this has to
Ah,
go
now will be
first through
removed,
the bone,
then
and then
Yeah.
you put it again, and you make the
Yeah,
noise.
yeah, correct.
So
Yeah, that's because you need this to hold
This
it.
has to go through the hole. This will never pass through the hole.
Yes.
But that's because this is done because of the size. Am I right?
yes, you're completely right. So now I made a mess. Huge mess. That's good. Also, always good if you do a mess in demonstration. You can see how you can get rid of the mess as well. So it's okay. So, okay, so now we remove this. Keep it. Don't throw it away because you will need it. Oh, another one.
It's like you lose it and you're looking for it.
Yeah. So we will put this on the
On the
table.
floor, cling, cling, cling.
Tell the assistant not to throw it away. It will be needed. So this is now still in the package. We get our new gloves, blah, blah, blah. Now we go again to this stage here. We put this underneath. We do the retraction here.
You need another one to pull it to the side, correct?
Now we need to get rid of this part here, which is the ligament.
Yeah, but I was
So-
looking for this one. To
Yeah, or
push
this
the
one, yeah, perfect, yeah.
button
Yeah,
inside,
thank
correct?
you very much, yeah. So now take care
sorry.
to work in a clean
Easier
way.
so you can see.
So I will grab this. I will hold this in my clean hand. And now I will go and find the hole in the acetabulum. I will place it and then I will push it in.
inside
Yeah.
and pull.
Yeah, push it inside, really give it all the way inside, and then I usually pull on one side first, and then I pull on the other, and then I do the lifting maneuver, so I really try that it's like really, you see that the cat is lifted from the table a little bit. So everybody can have a glance
I mean, if
inside
it's not
now.
placed properly,
It will
comes
come.
out.
It will come
Easy.
toward you.
And you put it
I
again.
had it once because I did not see initially a medial wall fracture. I did not see it.
Oh, so there was
So
a
I did
crack in the
everything.
acetabulum.
Yeah, and then I pulled and it came towards me and it was a medial wall fracture. So it was not well.
In which language were you swearing?
Say?
In which language were you swearing?
Well,
Good question.
Because after tightening everything,
pick one.
So it is a good question. What do you do if accident?
Good, we're happy and we're stable. So now the shuttling. The shuttling can be very, very, very ugly. So I showed you this nitinol needle from Arthrex. I'm not sure we have a nitinol needle here or shuttling needle here. So what you can also do is, if you don't want to buy the needle, you can also use suture
yeah,
material.
because the cangra is rigid enough to grab it. Yeah.
So what you can do,
Should I
you
remove
can
this?
go out. Yes, perfect. Thank
I
you.
leave.
You have one? That's nice. So look at this. This is probably the instrument that changed my life the most.
But you can introduce the...
But for a lot of things.
Yes, you can use this for any shuttling of a suture material.
Makes you cry.
You see, it's nice and flexible. So this instrument, if this course was not valid for you, it was valid because you got to know this instrument. This is really, really good. It's really
What is the
changed
name?
my life. It's a suture passer, and it's really good.
Can be used for metal wire for circulages, or is not strong enough?
No.
Okay.
And it will break. After some time
Okay.
you use it, this one will break. Be gentle with it, and you can reuse it several times. But this really changes the life, because you can see now what you just do. You just simply find your hole, you put it through here, you turn you turn the leg, you grab your nitinol needle here, you put it out, and then you go 2 by 2. So let's say you just use now the zebra.
Two
this
of the
is the
same
blue.
kind.
So you take the blue, I take the zebra, and then you just shuttle them through here. And this is really, let's get them together. And this is really very easy. You see, you hold it, you tension it, you put it through, a done deal. So this is really, really
Let's
nice.
say we don't have it.
The suture passer. Then you do the following. Then you do, if you
Can you
have,
put it double?
you can.
Because
You,
it's
I
rigid
do it.
enough.
I do it 4 times. So I will go. I will show you later.
Yeah,
I will
please
show you
show
later
me
what we
one,
do.
at least
Yeah.
like what
So
you
now you are working in advance. That's very good. I like that. So perfect. Do you want to pull it through? Or yeah, just pull or whatever you pull through. Yeah. Now you have to be a little bit more power, because we already have 4 strands in between. So now we do reduction. Pump goes in the acetabulum. So it goes in now, you see? Now we pull.
And
Somebody's
we
holding
check-
the leg in a normal angle.
Now we need that.
So now we do
Button.
this. Yeah. Now we need the button. Not throw it away. Perfect.
You never know how
So
to do it.
now usually it works pretty easy if you take your button here, grab it like this, and then usually you can do the hit like this, put it through, and then you just flip it over like this, hold it like this, take the other 2, make sure they're parallel and not cross over. So take them like this, and then you align them also aside, and then you just do. I need to eat. Don't drink coffee.
Too much coffee.
Too much coffee. Like this. Now we tension it down. And now I give this to you. So we make sure that the hip is reduced. And now we take this one and do a first knot.
Double.
Tension it down.
So
and now
not
we
normal
do
knot, double.
now we do the bow tie.
Yeah.
Surgeon.
The surgeon's knot, yeah, now you do the bow tie like this. Now I do this tying here. Also
This is
pulling.
what you will tie it twice after moving.
Yeah, I will do the pulling here. Be aware that this suture material is strong and it cuts. You can use instruments or swaps if you have gentle hands. So
We
if you-
don't, so.
Well,
I usually get
I
cut
just,
in
I just,
when
I'm
when
just
I do
telling
a
you
lot of
because it's
procedures,
painful.
I end up
It's
with
painful.
cuts.
So just that you
But
know.
it's big. But it's 2 size.
Me? You should see my
So,
hand.
and now
Because
you
of
go
the
like this.
surgery.
You really, you pull it like this, just that it's firmly seated, and then I go put another one on top.
Clockwise or anti-clockwise, or how do you do it?
So
Do
this one could be actually a little bit
Clockwise,
loose.
anti-clockwise?
So I alternate. Yes. So now you go and you do a circle.
But this one could be still actually a little bit loose.
Could be, but now then we have the other one, which is like
So
tightening
you will
really
tighten.
down.
So only one will
Yeah.
be tightened twice.
Well, yeah. Well, this is now because we have tightened this, and now we have tightened this, and now we will re-tighten this.
Yeah,
Okay.
but only one you tied twice.
Yeah.
The other one
yeah.
is
The other one is now we remove all the slack out of the system, and then we go to the other one. So we will do it. We will do some more with that one later on, and now we remove this and really tighten this down.
Double, single enough.
I do 5 knots usually.
So double and one other single.
yeah.
Okay.
So now we go ahead and do alternating.
Up and down, yeah. 4, 5.
5. Done. So now we can cut this.
How short? Oh my god.
like this, and now we can.
I would not sleep overnight with the idea that can get open.
And now we need to do to add more of this.
Really?
You just need to pull hard. That's why I say it's cutting your finger. Like,
Now to cut so short, close to the node, I'm afraid it would get open.
No, because it's doing 4 times, 5 times.
Right,
so
that's
like this, pam pam pam, really nice and tight. Cut it, and now you can see.
Now close.
Look at this now. That's what I showed you. You will be astonished on how much it comes out. You see,
It's perfect.
but still it's stable. You know.
It's okay to
That's
that
it.
stage.
That's how it looks like, and you will see if you try to move it, like grab it, move it up, you will see it's not moving out of the acetabulum. You see, even if you do like this,
He's
it's
a cat,
really
he's
stable.
not a 50 kilo dog.
No, and this, as I said, you see now. I don't know when we started. We have